step-by-step instructions to fight the baldness gene, and other factors. Hereditary qualities of thinning up top. Different causes. Easing back going bald. Takeaway. Despite the fact that hairlessness is frequently considered as a male issue, balding can influence anybody, paying little mind to their sexual orientation. Hereditary qualities assume a huge part in deciding how much balding you'll see as you age. Notwithstanding, different elements, for example, feelings of anxiety, sustenance, and meds, likewise cause going bald. Hereditary going bald can't be turned around, yet there are steps you can bring to back it off and boost your hair development potential. In this article, we will analyze the hereditary qualities behind thinning up top, disperse a typical going bald fantasy, and take a gander at how you can moderate genetic balding. The thinning up top quality clarified. At the point when balding is brought about by your hereditary qualities, it's anything but an anticipated example regularly alluded to as male example sparseness, MPB, or female example hairlessness, FPB. For men, MPB begins as a molded downturn at the front of your scalp and regularly begins in your 20s or 30s. Around 80% trusted source of men experience MPB by age 80. Ladies frequently experience balding after menopause in the Ludwig design, which is a progressive downturn along the piece of your hair. Generally, half-trusted source of ladies will encounter female example hair when they're 80. Androgenetic alopecia, the clinical name for MPB and FPB, is the most widely recognized reason for going bald. Studies seeing twins gauge that hereditary qualities represent around 80% trusted source of male example hair sparseness. Male example hair loss. You may have heard the legend that men acquire the quality for sparseness exclusively from their mom's dad. Despite the fact that this isn't generally the situation, there is some reality to it. Actually, the hereditary part of male example hairlessness actually isn't surely known. However, it's believed to be polygenic trusted source, which means it includes more than one quality. Individuals have 23 sets of chromosomes that contain their hereditary data. Everything from your eye tone to the length of your child toe is coded for by these chromosomes. One of these sets of chromosomes, called the X and Y chromosomes, decide your organic sex. Ladies have 2 X chromosomes while men have 1 X and 1 Y chromosome. Men acquire the X chromosome from their mom and Y from their dad. Hair loss is unequivocally partner with the R trusted source gene trusted source found on the X chromosome. An enormous report taking a gander at 12,806 men of European lineage found that individuals with the quality had more than twice the danger trusted source of creating MPB than individuals without it. Notwithstanding, this isn't the lone quality that decides if you'll go uncovered. A 2017 review trusted source discovered 63 qualities that may assume a part in male example hairlessness, with just 6 of them found on the X chromosome. Examination has additionally tracked down that in excess of 80% trusted source of individuals encountering recognizable thinning up top had a dad who likewise lost their hair. Female example hairlessness. The hereditary segment of FPB is still generally unknown trusted source. However, like with MPB, it's idea to include a wide range of qualities. Qualities that code for the creation of a protein called aromatase trusted source convert testosterone to estradiol may assume a part in FPB, and clarify why numerous ladies lose their hair after menopause. What else causes thinning up top? Alongside hereditary qualities, an assortment of different components can add to going bald in individuals of any sex. Ladies frequently notice going bald after menopause because of hormonal changes, while men regularly notice going bald beginning in early adulthood. Hormonal changes. Ladies ordinarily experience going bald after menopause, labor, and pregnancy because of chemical changes. The two people may encounter going bald from changes in thyroid chemical levels. Alopecia areata. Alopecia areata is an insusceptible condition that causes inconsistent balding. Trichotillomania. Trichotillomania, additionally called hair pulling problem, is a psychological issue that makes the urge pull out your own hair. Other ailments. Ailments like ringworm contaminations, cicatricial alopecia, and horrendous alopecia can likewise prompt going bald. Certain haircuts. Haircuts that put weight on your hair like tight pigtails can prompt a type of going bald called foothold alopecia. This sort of going bald can be perpetual or brief. Medications and enhancements. As per the Mayo Clinic, drugs used to treat the accompanying ailments may prompt balding. Sadness. Heart issues. Gout. Hypertension. Malignancy. Joint pain. Anti-conception medication. Suspending the utilization of anti-conception medication pills may likewise prompt brief going bald. Radiation treatment. Radiation treatment is normally utilized in malignant growth therapy and regularly causes going bald. Regularly, this balding is impermanent. Stress. Drawn-out times of physical or mental pressure can prompt brief hair diminishing. Dietary lacks. Not getting satisfactory protein or other fundamental supplements like zinc can contrarily affect your hair development. The most effective method to moderate balding. Balding brought about by hereditary variables is lasting and there's little you can do to stop it. In any case, there are a few different ways it tends to be eased back down. Sound way of life propensities. Eating a fair eating regimen, getting satisfactory rest, limiting pressure, and practicing consistently can assist with supporting your general well-being and hair well-being. Skin meds. Skin drugs like minoxidil, Rogaine, are frequently the principal line of treatment. For the most part, you apply these creams straightforwardly to your scalp in thinning up top regions. Oral drugs. Your primary care physician may suggest oral meds like finasteride, Propecia, to treat MPB. Finasteride is additionally used to treat an expanded prostate. Hair transplantation medical procedure. Follicular unit transplantation and follicular unit extraction are two sorts of hair transplantation medical procedures that move hair follicles from one piece of your scalp to thinning up top regions. Laser treatment, red light treatment. Laser treatment may assist with further developing hair thickness. Trusted source in case you're managing hereditary going bald or going bald from chemotherapy. Notwithstanding, more exploration is expected to decide how successful this treatment choice is. Platelet-rich plasma infusions. Platelet-rich plasma infusions may assist with invigorating hair development in regions encountering going bald. Like with laser treatment, more examination is expected to comprehend its viability. Takeaway. Hereditary qualities unequivocally impact balding, regardless of your sexual orientation. The hereditary part of going bald still isn't surely known. However, its idea that it includes a wide range of qualities. Albeit hereditary balding is lasting, meds, laser treatment, and platelet-rich plasma infusions may assist with animating hair development in going bald regions. A few group likewise get hair transfers to cover spaces of going bald.